You have tuned into your number one urban radio station, 97.5 kmet FM. And today we'll be talking Nottingham Healthcare with the Nottingham Healthcare Foundation Trust with Mr. Ifti Majid. Good morning.
Morning.
How are you?
Yeah, I'm really good, thank you.
Awesome. So let's get into it. So can you tell us about the services the Trust provides?
Yeah, so we're a provider of integrated mental health and community services to the population of Nottingham and Nottinghamshire, but also to East Midlands population and actually a national population. So we deliver a whole range of mental health services, both community and inpatient, and we also deliver community physical health services, so services like district nursing services. We have 2 hospices. We have a community hospital. So those are the services we deliver to the local population, but we also have medium and low secure mental health services that we deliver to across the whole of the East Midlands. We've got high secure services, one of only 3 high secure hospitals in the country for people with mental health difficulties, and we deliver healthcare into 11 prisons across the East Midlands. So, big trust. About 10,000 staff work with us day in, day out.
I guess that takes, there is a lot of demand on the work that you do provide.
Yeah.
And so have you seen an increase in the demand for mental health services with pressures like COVID and obviously the cost of living crisis?
Yeah. As we were in the middle of COVID, I was involved in some work trying to predict where the demand peak would happen for mental health services, and the modelling showed us that it would happen about a year after COVID. So therefore, it's no surprise that we're seeing that sort of demand now, and it really has overlapped with the cost of living crisis. Nationally, would you believe that 33% more people are using mental health services now than they were before COVID? And for children and young people, 80% more using services. This is a significant rise, and one of the things that upsets me quite a lot is, on the radio, on television, you hear lots of talk about the emergency department, the big hospitals like NUH, but in mental health we're seeing significant demand that's just not talked about.
This seems to be as well, because you mentioned the news, some sort of overrepresentation of young black men in secure mental health services. Where do you think that is?
Oh, this is a really difficult question, I think, and I think there's multiple reasons, and I'll share with you my view, my personal view, but obviously it's based on evidence. So there's something about the sad fact that young black men often are in a position where they don't have the best experience in schooling and education. They may have difficulty with housing. They may have difficulty with securing employment that they want. These 3 things have an impact on people's mental health. So hold that as a backdrop. But I also personally think that if you experience discrimination on a regular basis, if you are discriminated, in all those settings I was just describing, that is going to have a significant impact on your mental health. And then I would also say that if I'm being discriminated against, and clearly coming from a BME background myself, I have been discriminated against, then that has an impact on you, the confidence that you have in public services. Because why am I going to lay myself open and put myself in a vulnerable position potentially with a public service when I know that maybe I'll get discriminated against? Therefore, my experience is that young black men are less likely to come forward and seek help and support, so they delay coming forward. Their illnesses are worse, and we find ourselves having to treat them more intensively. So I think those are the reasons why, and I would urge people to come forward early and get help and support. But in that backdrop, it's a difficult and understandable thing why people don't have that level of confidence that we would want them to have.
To follow that, that's very true. And all these different causes, how does your staff and services are able to deal with that sort of racial trauma?
Yeah. So change starts at the top, and I think we need to make sure that the most senior leaders in our organisation, people that make decisions, as well as clinicians, there is some personal growth and understanding that they need to go through. So I believe that we need to stop. In the NHS, we tend to have quite a negative narrative, I think, about discrimination, in that we tend to talk about you shouldn't, if you discriminate, then the negative things will happen. You mustn't discriminate because actually what we need to do is talk about inclusion is really important, because these are all the benefits. People get better if they're treated in an inclusive way. And we call this pro-equity. So actually we're being positive about equity rather than negative about it. And so the sorts of things that we're doing is training and development programs. And one of the things that I think is really important is that we help leaders and managers to understand their bias. Because we're all biased, aren't we? We help people to understand our bias. We help people to understand how their life experiences impact on them as leaders. We help people to understand and have conversations about difficult things like, what's the history of racism? Racism, as well as I do, it's a social construct. It's something that was made by white people back in the 19th century, really. And we need to have those conversations, because many leaders don't understand that. They don't understand that we still talk about things that were created in the 18th and 19th century as part of this. We need to talk about that. We need to talk about the impact that colonialism has on the UK and on the NHS, which comes from those sorts of roots. If we don't have those conversations, then it's not brought to people's conscious. Therefore, they can't do anything about it. So that sort of training and development for people that make decisions is really important. And then, of course, we have lots of things that we do in the organisation. We have allyship training, we have equality and diversity ambassadors, we have things like networks, so colleagues from BME backgrounds can come together so to get support. So we have to be active in this space. We have to go out of our way to be inclusive. This is so important, because organisations that are more inclusive have better outcomes, and that's evidence based.
Thank you, Mr. Ifti Majid. It's very important, and listen to what you actually said with representation is when you can relate to the person you're talking to and helping you more, you listen to them more. And then that has happened many in different spheres, not just in the health services. And as well, very true, things can get better, can improve. And I'm happy that we have someone who can also see it from that way and wanted all that to change and get better. So for those who had, let's say, somehow a different experience, okay?
Yes.
So there could be some reinsurance then you can give to someone or a family member who has had a bad experience of your services. Like I said, things were bad, but then they are improving. Can they trust the services in the future?
Yeah. Do you know, I think that we need to be prepared to say that we're sorry, and that we need to be prepared, and that's always my first stance point, is that if people don't have a good experience of our services, then we need to say sorry, and we need to explain that we're a learning organisation, and that what I'm interested in is hearing people's experience, hearing why it's not met their expectations, and then doing something about it, and having those conversations within our organisation that says, this individual has had this experience of our services. What are we going to do to stop that from happening again? And then I think what gives the confidence is then giving that feedback to people to say, thank you for telling us how it felt. This is what we've done about it. This is how we've changed things. This is what you could expect if you need to come back again. Because I think that we've got to continually learn. We've got to continue to develop. And that's how we make things better. And we're not going to get things right first time, every time. But we can ensure that we take that feedback and we do something different.
Brilliant. I love that. Thank you very much. One final question. So what do you think the organisation can do to increase trust in the black community of your services?
Yeah. A very famous person once said that you can't lead if you don't listen. And I think that, for me, one of the most important things we need to do is to listen to the community and listen to our communities. And I think that the NHS has a habit of looking to government, to looking to NHS England, organisations like mine. But actually we need to look to our local communities because we're accountable to our local communities. And so for me, there's something about taking feedback. There's something about using that feedback to provide culturally accessible, relevant services. Because again, we need to adapt our services to different communities and different communities' needs. We can do some of that. We need to ensure that people's voices are acted upon, and I think we need to be prepared to share things like data and information. So we need to be able to feel confident to share with our communities. This is the data that we have. This is how many people from this community get interventions or services from us. This is how it fares with a white community up the road, so that we can understand why those things might be happening and bring about changes. But I would finish with my plea, which is, if things don't feel right, if you feel in need of help and support, please seek us out. And just a reminder that we have a 24-hour, 7-day-a-week helpline that members of the community can call to get immediate help and support.
Yeah, thank you very much. So it was a pleasure to have you, Mr. Majid. Thank you for your knowledge, experience, and the work that you're doing with the healthcare services.
No problem.
Thank you.